It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show, Expresso, right here on SABC3. It's time for us to hone in on something that's truly important and something that we don't often speak about, and that is the state of mental health in South Africa. World Mental Health Day was observed this Saturday on the 10th of October. The COVID-19 pandemic not only had negative effects on our mental health, it also made a priority within healthcare services. This meant that mental health services were paused to make room for COVID-19 patients, but with our numbers dropping in life slowly but surely returning to new normal, mental health services are being reintegrated back into our system. Now this morning we have a special guest, Minister of Health in the Western Cape, Dr. Nomafrench Mbombo, joins us to tell us more. A very good morning to you, Dr. Enkosi kakhulu for joining us.
Good morning everyone.
Molo, Doctor. So good to have you here, Minister. This is such a good time because we know that a lot of healthcare services were paused, specifically when it comes to mental health, to make room for COVID-19 as we faced a pandemic as the country and as the world at large. But these are slowly resuming. What's that state looking like at the moment?
Oh yes, it's about time to reintroduce the non-COVID cases. Actually, mental health is one that actually took quite a blow, where you'll find that almost 60% of the patients who were taking treatment now find that they have to default. And we don't even know about any new ones who might probably haven't been diagnosed yet. But before we start with a reintroduction, bringing them back, because we started to de-escalate the services because we're preparing for the COVID, meaning that for the patients who want to come voluntarily, if they feel like they've got a problem, we have to put a pause. And for the patients who are already admitted, it meant that we have to discharge some of them. And then also we have to rearrange our services because also as part of the laws, people can be admitted for 72 hours for admission. I'm talking about for those who are not necessarily mental health users who haven't been diagnosed, meaning that they have to be diverted elsewhere instead of going to the district hospitals. And also for those who will be taking treatment, we have to give them the 2-month supply where we will send community health workers to be able to drop, and also Uber to drop them at their homes. So we had to pause quite a lot, but now it's about time that we reintroduce, take to consideration that with the COVID, there might be other people who will have been affected actually psychologically.
Absolutely.
So that's why that there is no health without mental health.
Yes.
And, you know, mental health is something that's easily overlooked, especially during the time of COVID-19. And I'm very appreciative for you and your team to, you know, to kind of come with alternative notions to help people who are, you know, dealing with mental health. An interesting find earlier on this year stated that the Western Cape has the highest prevalence of mental health. I think that's...
It's a big challenge.
It's a big challenge, Minister. How are you dealing with that?
You see, there are many contributing factors. For example, substance abuse. We do know that the issue of the young persons abusing drugs like a tick, they also contribute to such. But also take into consideration that when you have got a high level of economy, where it's a fast kind of a mobile community, and we find that most of people will be coming from outside Western Cape to see for economic opportunities, but they don't have nuclear family. So they might be residing in areas or with the people who are not necessarily family where they could be able to open up. So this is some of the contributory causes. But generally in South Africa, around about November, you'll find that there is a whole lot of psychiatry issues, mental health issues. And we don't know the cause, the contributory cause.
At that time of the year, you can imagine so many factors.
Especially when people know that they might not be getting bonuses. But with the COVID, take into consideration in terms of the economy and unemployment. It's no longer about the lower socio-economic kind of environment. But the people who have lost businesses, the suicide rates, where we have already seen in terms of the research. So this will have quite a huge impact. So that's why it is crucial that World Mental Health Day, which was on Saturday,
Yes.
I'm wearing orange because it resembles.
Because that's
I love
part of the
that.
theme.
Yes, yes, it's about that. So it is crucial that we reintegrate. So already things are happening, but slowly, because in taking note, if you have got, you are a mental health user, which is you are already a person who has got affected with mental health, and also have got a COVID. You can imagine in terms of the double kind of
There's a lot.
Yeah.
Before we let you go, Minister, I've got to ask you this. What is the country doing and what's the government doing to really make sure that we are there for our citizens when it comes to focusing on mental health? What interventions is the government putting in place, specifically in the Western Cape, but of course looking at the country broadly?
Yeah, I think the first and foremost, it's about to destigmatize, because the issue of the stigma, it makes people not to open up and come.
Yes.
Because people, they will say, I'm sad. You must understand that depression is not only about sadness. Anxiety, it's more than being worried. Same applies that with the issue of the bipolar, is more than just mood swings. It needs a medical intervention. So we must open it up. Just like as I indicated earlier, indicated that mental health is part of the general health. There's nothing wrong to say I am sad, I need to medical help. So we need to destigmatize, and also for those who are affected by that, we need to love them and show some care.
I love that so much. It truly is serious. Sivile Ngogwethu from, the MEC of Health here in the Western Cape, Nomafrench Mbombo. Thank you so much for taking the time to join us, Namhlanje. A lot of people overlook the importance of mental health holistically when it comes to health. So for Wayne to come here and speak on it and encourage people to, help each other and open up and accept that you are not okay. It's a broad spectrum. So once again, Enkosi kakhulu for joining us.
Thank you, Enkosi kakhulu.
Now make sure to take care of your very own mental health and your own well-being in that regard. Just as you would if you felt like you were coughing or you felt a bit of a cold, go see a doctor. You should definitely be doing the same thing when it comes to your mental health, when you're feeling sad, when you're feeling otherwise out of balance. But thank you very much, of course, to the Minister, Nomafrench Mbombo, for joining us once again.